get started.
Sure.
So, given COVID-19, can you discuss some of the changes and expansions to unemployment insurance?
Yes, I can. There are a lot. Let me first start off by saying when unemployment is not available, though. So if somebody can safely work at their employer's location, if they can telework, if they're on paid sick leave or paid family and medical leave, then they're not entitled to unemployment benefits. Also, most undocumented workers are not eligible. There are exceptions, so people who have DACA status or others with work authorization are eligible for unemployment benefits, but most undocumented individuals aren't. So there are really two kinds of unemployment benefits. Traditional unemployment benefits are for workers who lost their job through no fault of their own. They have an employer, they get a W-2, that's the unemployment system we all know. And those folks may qualify for unemployment if they're not working because of COVID-19. So if they're furloughed, if they were laid off, if they're self-quarantining, if they're home caring for children because the school has closed, they can be eligible for regular unemployment benefits. And they can also get partial unemployment benefits if they're still working but their hours were reduced. One thing we're starting to see is employers calling workers who have been getting unemployment benefits or have been unemployed, calling them back to work. And people are saying, can I stay on unemployment? I don't feel safe going back to work. It's a little bit a fact-by-fact situation now, but in general, if someone has a generalized fear of going back to work, they may not refuse that job and still get unemployment. But if they have a specific reason that they would not feel safe going back to work, the employer isn't providing personal protective equipment, or the person has an underlying health condition like asthma or diabetes that makes them more vulnerable in the workplace, they might have a justification for refusing that return to work and for continuing to collect unemployment benefits. So people traditionally have been eligible for unemployment for 26 weeks if they remain unemployed. They're now, with the new Federal CARES Act, they're going to be eligible for extra 13 weeks. And they're also eligible if they get even $1 in unemployment benefits, they'll get an extra $600 a week from the new federal program, and that will last from March 27th through July 31st. So that's the regular unemployment. The brand new program, which is great news for people, is called PUA, Pandemic Unemployment Assistance. And that's because traditional unemployment left out a lot of workers. In this new economy, there are people who are self-employed, there are gig workers, people seeking only part-time work because of responsibilities they have at home. They've all been left out of the traditional unemployment system. But the new federal program, the Pandemic Unemployment Assistance Program, gives benefits to all those people. And it's comparable to regular unemployment benefits. People will get a minimum of $200 a week plus the extra $600 a week that I just mentioned. One big difference between traditional unemployment and this new federal program, though, is that with the new federal program for the self-employed workers, the part-time workers, they have to be unemployed for a COVID-related reason. So I was hoping to be able to tell you that people can apply for that benefit now, but just before this started, I checked the State Department of Labor website, and the button to apply for this program is not up yet. It's a two-step application process. In Connecticut, people have to apply for regular unemployment first and be denied. And then when the red button comes up on the Department of Labor website, they can apply for this PUA, or Pandemic Unemployment Assistance.
Thank you, Sue. Thank you very much for that. How does someone apply for unemployment? And what does the turnaround look like? I know a lot of people are questioning what the turnaround is and the time frame. Can you explain that a little bit for us?
Sure. It's mostly at this point an online process, which is the Department of Labor website, which has instructions for people who are having trouble with the website or who don't have internet access. There are 2 phone numbers staffed by Department of Labor employees, and this is despite on their homepage saying we don't give telephone assistance. They do, and I'm going to give you these 2 magic numbers: 860-263-6975 and 203-455-2653. And they say they also have Spanish-speaking people available to help folks with applications. So the PUA is not up, as I said, for regular unemployment benefits. You probably heard that the delay time was about 6 weeks. It's now down to about 1 week between the time of application and the time the initial decision is made.
Excellent, thank you. What are some of the changes in medical insurance and enrollment given the current pandemic?
So both private insurance and Medicaid, which is called Husky in Connecticut, now pay for many more telehealth services than they did before. Before, hardly any telehealth services were covered. Now they're covered by Medicaid and private insurance. Anyone in Connecticut can get tested for COVID-19, even if they have no insurance. Unfortunately, even if they're positive, the treatment is not free unless it's emergency treatment if somebody is on Medicaid. If someone loses their job, they can apply, and they got their health insurance through their job, they can apply online for replacement insurance through Access Health Connecticut. They will accept people enrolling if they are contacting them now because they lost their job. And Access Health will screen for Husky eligibility or eligibility for financial assistance with one of the Obamacare programs. The Department of Social Services, which administers Husky, has recognized the problems caused because its offices are closed down. So they're making the bureaucratic processes less formidable for people. So if somebody is already on Husky, there's usually this tedious process, lots of paperwork where people have to renew. But right now, if somebody's Husky expired in March, they're going to be auto-renewed through June. And if their Husky expired in April, they'll be auto-renewed through July. And the really good news is that if someone is currently on Husky, their Husky will not terminate until the end of the month that the public health emergency ends. So even if the person earns more money and is not financially eligible for Husky, or if they age out of Husky or something, they're still going to be able to stay on. And finally, for people with prescriptions who have a hard time getting to the pharmacy, they can get prescriptions for 3 months now instead of just a 1-month prescription. So those are the big changes in the medical programs.
Great, thank you. Has COVID-19 also affected benefits around food insecurity?
It has. So food stamps or SNAP have been expanded. So for the last 2 months, March and April, every household got the maximum amount of the SNAP benefit. So if it was a household of 1, they got $194, a household of 2, $355, a household of 3, $509. Also, because schools are closed and the government recognized that families have additional costs feeding children at home who used to get fed in school lunch programs, there will be extra SNAP benefits retroactive to March 27th for families who have school-age children. They'll get an extra $114 a month. It'll either be loaded on a SNAP card if the family is already getting SNAP, or it'll be loaded onto the Husky card. And this is going to be available to immigrant children too, even though immigrants are not usually eligible for SNAP benefits. It doesn't matter whether they're documented or not documented. And if somebody is applying for SNAP for the first time, generally the federal law requires an in-person or on-phone interview. The interview requirement is going to be suspended. So the application process is easier and there's more money.
Excellent. So given that the closure of the state buildings, an individual can now call in and utilize that avenue, or is it just via the internet right now?
They're still taking calls.
Excellent. Okay. Do you have anything else to add to the unemployment, given if someone has been on unemployment previously and some expansions that they can utilize?
Sure. If I could just circle back to one more benefit program first before I answer that question. So people probably know that temporary family assistance, which is the cash assistance program for parents or guardians who have children, has in Connecticut, generally there's a 21-month limit for getting those benefits, and then people exhaust them or time out. But because of the pandemic, people can now get temporary family assistance, cash assistance, if they haven't used up 60 months of benefits. So the 5-year federal maximum is now applicable in Connecticut, and there's also auto renewal for that. I have to say that TFA is very little money, actually. So if somebody is eligible for unemployment, financially, they'd be much better off going for unemployment, either traditional unemployment or the new PUA, than they are for cash. But if they're not available for temporary family assistance, then for unemployment, then temporary family assistance is good to know about. All right, now I've forgotten the question you asked me.
I asked about someone that may have been unemployment previously and now is unemployed again during COVID-19. Is there any way that they can go back on unemployment if they've already exhausted it? Okay.
Thank you for the reminder. Yes, as part of the Federal CARES Act, there is a program called Pandemic Emergency Unemployment Compensation, PEUC. Whole lot of acronyms flying around here. But what PEUC is 13 extra months of either regular unemployment or PUA benefits for people who've exhausted either of those programs. The Department of Labor does not yet have PEUC available. They haven't programmed it in yet, but it will be available in Connecticut. And what the federal law says is the Department of Labor has to contact everyone who's exhausted their benefits, their unemployment benefits since July of 2019, and let them know that they might be eligible for this 13-week extension. That hasn't happened yet, but it will.
I don't know if you have any additional information that you'd like to share with the audience, but that's all the questions that we had for you today. And I know that there are some questions coming in from the audience if you'd like to go there.
I'd be happy to take questions.
Okay, so the first question we have in the chat box is, with the PUA, will the funds be retroactive from when they applied for them and denied state unemployment insurance?
The great question. The answer is that they will be retroactive to whenever they originally applied, even if it was for the original unemployment insurance.
Okay. Is there anybody else that would like to ask a question? They can go ahead and unmute their mic. Don't be shy. I'll check over to our Facebook. Right now, we do not have anything on our Facebook Live page, but we have about 10 attendees on there as well. So if there is any other questions, please feel free to ask them now. If not, we'll probably wrap up.
I have a quick question.
Oh, go ahead.
This is regarding a client who might want to apply for health benefits.
Mm-hmm.
For Access Health, would SSI income be countable income for applying for Access Health?
So if someone is on SSI, they probably shouldn't go through Access Health. They would go through DSS because they're probably going to be eligible for what's called Husky C. And Access Health, it's DSS that does that. So this person on SSI doesn't have Husky already?
I think the Husky C income limits are very low. So even the SSI monthly benefit might exceed the Husky C income limit.
No, someone who gets SSI should be eligible for Husky C. Income shouldn't be a problem.
Then let me make it kind of a more specific situation.
Okay.
Let's say it's a husband and wife. Okay. Each one of them gets, let's call it $500 a month from SSI, and the wife gets an additional, let's say $1,200 a month from SSDI. Based on that income, would they be eligible for Husky, or would they have to apply for Access Health?
So she probably doesn't get any SSI, because if she gets $1,200 in SSD, that's counted, and she wouldn't get SSI. So her income is probably just SSD, and he would get SSI. Has she been on SSD for 2 years?
No, actually, she just was awarded the SSD, and they also awarded her the SSI as a spouse of the SSI recipient, which is, I've never heard of that, but
yeah, that's not going to happen. That's going to end up being an overpayment because she's not going to be able to keep that SSI.
Okay. So based on that income, they'd probably be under the Husky, maybe Husky D, or I don't know.
No, you can't. She can't be on Husky D. Do you know what? Why don't, this is probably getting into the weeds more than other people want. You can contact me directly at Greater Hartford Legal Aid.
All right.
I will give you my direct phone number, okay?
All right.
860-541-5020.
Okay, thank you so much.
You're welcome.
Bye-bye.
And that's what a benefits practice is like, juggling between all kinds of programs with incompatible and incomprehensible rules.
We have,
and that's what legal aid can help with.
Got another couple questions from our group chat. The first one is, are there any specific new ETAs on the arrival of PUA, red button, or PEUC? And for a PEUC, is it just waiting for a letter at some point?
So by ETA, I think what they're referring to is guidance from the Federal Department of Labor. There's been lots of federal guidance on the PUA, and it gives some discretion to the states, and there's no absolute timeline. I mean, Connecticut intended to have this up and running on Monday, and apparently they've run into glitches, but so far they're not running afoul of any federal guidance. The federal guidance, the ETA, or it's actually called a UIPL, does say about the PEUC. Again, it doesn't say when the state has to have it up and running, but it does specify that the benefits have to be retroactive to the date of eligibility, not the date that the state actually gets it operational. So it's really hard for people to wait for these programs to be implemented by the state and to have that income gap, but in the end, they're not going to lose the money.
Okay. And then just for clarification, the telephone numbers that were provided earlier, those are for unemployment, correct?
That's correct.
Okay. All right. And those are also in the chat up at the top if anybody needs those numbers again. Another question coming in from Judith is, are there any protections for renters when the moratoria on rent and utilities payments expire?
The housing advocates across the state are working on that. I guess just stay tuned. And one of the proposals that's out there is for a rent bank, because people's, even if the rental payments are postponed, eventually they're going to come due. And if people don't have the money to pay them, they are at risk of eviction. So there are requests that have been made to the governor for a rent bank that will help people pay their rent, but no answer yet.
Okay, thank you. Another one coming in from Erin is, I have a client who was denied unemployment benefits. She's a hairstylist and changed locations. She had been working a month before salons were closed. When she applied for unemployment, she was originally denied. Should I inform her to apply for the PUA?
It depends on the reason that she was denied. If she was denied because she left a job without good cause, quit without good cause, she can apply for PUA and she might get it, but ultimately that decision that she's disqualified from unemployment is going to come back to haunt her, because she will have to purge the disqualification by earning 10 times her weekly benefit rate. I know that sounds really technical, but she has nothing to lose by filing for PUA. I directly asked the Department of Labor the question of whether somebody, if they're disqualified from regular unemployment, if they have to appeal that disqualification before applying for PUA, and they said, no, they don't have to.
Okay, Erin just commented, she reports having left the job in good standing.
It's not in good standing. It's whether you left a job, whether you quit a job without cause attributable to the employer, because if you voluntarily leave a job, the way the Department of Labor looks at it is that it's then unfair to turn around and ask your employer, who you voluntarily separated from, to pay unemployment benefits.
Okay, thank you. Do we have any other questions from our participants? If so, feel free to unmute your mic. All right. Well, I guess we can close up for now. Maybe if there's any contact information you have, if anybody comes up with anything later that they could send over to you.
Absolutely.
Yeah. Okay.
I'm
Would you
just really quickly, Robin, do you want me to jump into this other stuff?
yeah, sure.
Okay. So I just wanted to really quickly make sure folks have all the contact information for Safe Connect. And actually, before I go over this, I did want to just say, so we are, this was our first Facebook Live conversation. We have 3 more lined up that we're going to do, and we'll then potentially continue to do this on Wednesdays. But just to get back at the question about housing, on Wednesday, May 20th, and this will be at 2 o'clock again. We'll do these at 2 o'clock on Wednesdays. We will be joined by CCADV's Director of Housing Advocacy, Annie Stockton-Sabrowski, and she will be doing our Facebook Live conversation that day on all types of housing benefits and issues impacting housing for survivors and changes that have occurred because of COVID-19. So hopefully at that point we'll have some answers to those questions and how and what protections are available for folks during COVID-19. Next week, May 13th, we'll be joined by Kai Belton, who is the clinical director of Safe Connect, and she will be talking with a couple of therapists around individual and family emotional well-being during COVID-19. So again, thanks everyone for joining us. We just want to make sure folks have the contact information for Safe Connect. This is Connecticut's domestic violence resource hub. It's available 24/7, every day and always, including during COVID-19. These are the services that are provided. All services are confidential, safe, free, and voluntary. So you'll reach a Safe Connect advocate via call, text, chat, or email, and we'll get to the contact information on the next slide. But they'll go through all of these things with you and make that safe connection for survivors and victims. So they're a local domestic violence organization. That's one of CCADV's 18 member organizations who will provide that ongoing support and services for survivors. So this is the contact information. Again, call or text 888-774-2900 or visit ctsafeconnect.org where you can live chat and email. Bilingual services are available. That chat, email, and text will recognize over 200 languages. But also, you know, by calling, we do have bilingual advocates on staff 24/7. And these are CCADV's member organizations. So again, wherever you are in Connecticut, we have a great member program that can help provide services for you. All right. So thank you again, everyone, for joining us today.
Thanks so much. We'll see y'all next
I
week.
have one more. Sorry, I forgot.
Oh, one more.
If you have any questions, from today, you can reach out to Kelly. And then if you do have questions directly for Sue, if you didn't catch her number, just email Kelly and she can always get that question over to Sue. And please do follow us, Facebook, Twitter, and Instagram. Thanks, everyone.
Thank you.
Bye, everybody.
Thank you, Sue. Thank you, Kelly.
Thank you, Sue.
Bye,
Thanks
everyone.
for inviting me. Bye.